such a high note right now, but I'm still going to ask the question.
So every time when someone pulled us down with those conversations, we just came back stronger. Healthcare isn't accessible to 50% of our population. How God helped us was that after 6 months, COVID happened.
I was waiting to ask that.
Yeah. And because I had pitched at so many places, and Ifat had pitched so many places, someone from the government heard our pitch. And that changed things for Sehat Kahani overnight.
Literal divine intervention to give you proof of concept.
Yes.
How do you sort of scale but avoid excessive burn?
We've always built smart. One of the things that really helps us is 3 of our verticals are cash first verticals. Actually, people kind of taunt us at some times कि आप हमेशा जाके बस बात करती रहती हैं और कॉन्फ्रेंसेज अटेंड करती रहती हैं और अवार्ड्स लेती रहती हैं. काम कब करती हैं? आपका फोकस काम पे नहीं होता. But I believe that when you come from a background where you don't have a network, you have to build that network yourself.
Absolutely. Hi, Dr. Sara. Welcome to She Talks Business.
Thank you. So glad to be here.
Okay. You launched Sehat Kahani with the objective to bridge the gap in healthcare, particularly for underserved communities. Obviously, you noticed a gap. You noticed that there was a need for it. What were those insights? What was that data that sort of pointed you in that direction?
So I started Sehat Kahani when I was 26 years old. To be very honest, I did not start Sehat Kahani based on some specific data. It stemmed from my personal experience, and I think the need part of it came from the final year of my medical college, which was my house job. So I did my house job in Civil Hospital Karachi, which is the largest tertiary care hospital in the country. And I did 6 months in the medicine ward. And Civil Hospital Karachi takes a lot of patients from through the country when they come to the biggest tertiary care hospital to get treated. What I saw in that hospital was at every 3 or 4 beds, every night that I took in the hospital, there was a death. And it was very, very common. The biggest reason for that is that patients came to that hospital usually at the last stage of their diseases. And they mostly had issues that could have been handled at primary healthcare. So they had hypertension or diabetes or bone issues or liver issues. But when they came to the hospital, they came at a stage when their relatives brought them eventually so that they can actually comfortably die in a hospital. And the relatives could be at peace that, chalo, end tak to hamara patient pahunch gaya tha hospital. That actually made me wonder, why is this happening? Why aren't these issues being handled at a primary care level in their communities? And when I delved into it further, and because I'm a woman doctor in this country as well, I realized that despite being the majority in the medical workforce, a lot of women don't practice after marriage or responsibility. We have a term for it called the doctor brides. When such a majority of your medical workforce sits at home, not working, that creates a gap in the doctor workforce. So all the remaining doctors, if they're not going outside the country, which is a huge trend even now, it was a huge trend when I started also, they want to work in the urban areas because they want good benefits, they want good pays, they want to live in a house, they want their children to go to school. Eventually, 60 to 70% of Pakistani population, which is rural, is left with no doctors at all. That space is filled with quacks, midwives, nurses, compounders, dispensers. I just saw a recent video of rural Punjab where the janitor of the hospital was putting injections to patients because in the emergency because there was no doctor.
Oh, wow.
So all those issues that I saw in that hospital, I realized that if we have to fix healthcare in Pakistan, we have to fix primary healthcare, which is where the story starts. And if we're able to fix that, a lot of healthcare issues that burden Pakistan today would be solved.
So tell us a bit about how Sehat Kahani works. Break it down for me.
So the main concept was that we create a network of women doctors that can provide healthcare digitally. And the reason for that is that doctors are bounded by responsibilities culturally or socially, and they're not able to go out of the house. And patients can't get out of their communities to get healthcare. And even if they do, it's a very expensive concept for them. Arranging transports, having a chaperone with them, and eventually a lot of people never do that effort in going to a hospital. So the basic idea was that we create a digital platform that connects these women doctors to patients online. Because I saw this problem in my house job, my first instinct was to solve this problem for the rural areas. So what we did was, because I had limited amount of money, I had won some money from startup competitions. I didn't have a lot of investor funding at that time. So I couldn't come up with a model that was very hard asset based. So what we did was we took midwife or nurse-led clinics in rural areas across the country, and we started converting them into telemedicine clinics. So we went to an already built 2-room space. We converted one into a waiting room, one into a consultation room. We changed the entire space into a primary healthcare center. So we actually put furniture, fitting, electricity, solar backup, internet connectivity, laptops, gadgets, printer, so that when a patient comes to that clinic in their community, they can be greeted by a qualified nurse who's trained on our software, and the patient can be connected to an online doctor through that nurse or through that midwife. And for this, we partnered with the midwife who was already working in that community. We gave her an incentive out of the consultation, and the rest was used to run the clinic. This was the first model that we went with. The company was launched in 2017. Until 2019, we had around 13 clinics in different areas of the country. Then me and my co-founder, we realized that unfortunately, through this model alone, we can't solve the huge gap of healthcare in this country. Healthcare isn't accessible to 50% of our population. So only working in those communities, in those limited communities, we won't be able to create a massive impact or a massive change. We also realized that we were only empowering 2 doctors per clinic. So we weren't changing a lot in the doctor story as well, because there are 80 or 90,000 women doctors who are today sitting at home.
Got it.
So we had to create something which was mass level. Then we started working on an app. And this app did everything that we did in the clinics. The only difference was that it was for an urban market, so that people like you and me could use it who have a smartphone. Plus, this model did not need an intermediary. So we did not need a nurse to convey anything to the patient, because the patient could download it and connect to a doctor directly. One of the things that I saw in my clinic that really inspired me in the 2 years that I was creating clinics across the country was when a patient came into our clinic, the aha moment came when they were connected to a doctor without waiting time, because they didn't have to travel, they didn't have to waste money, they didn't have to arrange transport. And we thought that if we would make an app for people, we would make it so simple that the patient could connect to a doctor within 60 seconds. So that we remove that barrier of waiting times, of the opportunity cost that happens when you go to a doctor today. So we created that option in the app. So Sehat Kahani is the only app in the country that connects you to a doctor in 60 seconds or less through an available doctor network who is in the app 24/7 in real time.
Literally the definition of health tech.
Yes. And I think that came from my idea that it should be so simple that my mother can use it. And my mother would not wait 15 minutes to be connected to a doctor online. Like you order food, right? It's instant. Everything happens cut. So we also wanted to build an app that gives you healthcare very quickly as well. So we made the app, and today, if I tell you how the app works, so our clinics are still there. We keep making clinics in low-income areas, but now what we've created is a sort of an impact business. The impact business definition is that you create a business that creates profitability so
Right.
that the business can grow,
Right.
but also creates impact through one of its vertical. And the high revenue vertical cross-subsidizes the high impact vertical.
Got it.
And this term I learned in my course in INSEAD in 2019. So I brought it back and literally implemented it in Sehat Kahani. So today the app works in urban areas. It's used by predominantly corporates in the country through their health insurance. That's our biggest portfolio. It is used by individual consumers through a consumer app. It is integrated in third-party applications as a B2B2C channel. And for low-income areas, we still run our clinics.
So I'm very curious, like this seems like, where yes, it's health tech and everything, but it to make it successfully work, there's a lot of like on ground penetration that is required. You're talking about using midwives from the different communities. Tell us a little bit about finding those resources and why it's so important to find resources within the community.
So when we started the clinical model, we started our first clinic in Model Colony. We found a nurse from the community who was very good. And my first clinic ran really well. So I got this euphoria that this model is very simple and would work anywhere. I opened my second clinic in Hijrat Colony. We hired a Christian nurse in a predominantly Muslim community. 6 months later, we had to shut the clinic down. We got death threats. The nurse got death threats, and it was a chaotic situation. I think the failure of my second clinic really taught me that if you had to create a community clinic, what are the do's and don'ts that you can do? So then we created a very stringent needs assessment criteria. So we go into a community which is more than 100,000 people, has 2 or 3 midwives available within the community, because we don't create infrastructure from scratch. We need a 2-room space which is already there, which has a decent influx of patients so that we can come in and increase the capacity of that clinic. We don't want to create anything from scratch. We don't want to be the aliens coming into that community telling them that aapko nahi pata.
You want it to
healthcare ho
seem
sakta hai."
seamless.
Exactly. And we wanted people to trust us. Even keeping the name Sehat Kahani was kept so that people trust a local name that they can remember. And it is a little poetic for them so that it creates that instant click. So we partner with the nurse who's already there, seeing 10, 12 patients a day. We tell that nurse that if you work with us, we will increase your patient count to at least 25 patients a day. So you will end up making more money. Your house or your space is going to look better. It's going to be monitored well. You're going to be doing something very legal and helping patients more. I think the secret sauce in this is if our nurse is good, which is working in that community, if she is good, that makes a lot of difference.
Because she's also
the
like
front
your
face.
salesperson.
Yeah, she's our front face, right? We
Yeah.
are not there. The doctor is not there. The patient is coming to her and she is going to tell the patient कि देखिए कितना अच्छा डॉक्टर है जो आपके लिए सेहत कहानी ने अरेंज किया है ताकि आप बेहतर हो सकें. So initially when we launched our clinics, we used to have 3, 4, 5 patients a day and it wasn't really working. But slowly and gradually, working on the nurses, working on their training, their soft skills, their medical capability, training our doctors to talk to patients better, slowly and gradually, the word of mouth spread. And communities are not like us. When they're sitting in the evening, they're not using TikTok or Facebook or Instagram or Twitter. They are talking to each other.
Right.
They are hanging out with each other. So the word of mouth spread in every community. If someone got better, they told the other person about it. Also, one more interesting thing happened in our clinics was 90% of the footfall is women and children. Why? Because men usually get the opportunity to go to tertiary care hospitals. They can travel alone. They can show themselves. If they're going for work, they'll just show to a doctor. But women are really constrained in those communities.
Right.
I still remember I was in rural KP looking for a space, and I saw that there was a lorry, an open lorry, at 8 a.m. in the morning that was taking a lot of women and children somewhere. And at the end of the day, they came back. So I asked the local person, where did they all go? So they said they went to the hospital because the hospital is in Ahmedabad. So they went to AU Medical College and they will all come back in the evening. So imagine that if you have to get a prescription from a doctor, you have to travel to another city 4 hours away from your village and then come back.
So this probably also happens in communities where the only doctor available is like a male doctor.
Yes, absolutely.
Because these women in a lot of conservative spaces aren't allowed to be
Never.
sort of checked up by a male doctor.
Absolutely. So if you don't have an option, you do go to a male doctor.
Yeah.
But for a lot of issues, you can't talk to a male doctor.
Exactly.
So they go to then a dai or a midwife.
Yeah.
Which is not trained to look at medical issues, who would train them with whatever information they have available.
Sure.
And that's why there's a lot of malpractice and malnegligence. So there's over antibiotic usage, over steroid usage, not finding the right reason for the right disease and treating them for something else. And a lot of women suffering in the end, long-term consequences for this. So a lot of women in Pakistan have fistulas.
Right.
Right? And they are so bad sometimes they have to press it in with their hands.
Yes.
They keep falling out. Why does that happen? Because when they're going into labor, they don't have a skilled worker attending to them. So no one is taking care of them and they push with all their might and they have the baby there and then, but eventually their pelvic floor becomes so loose that everything starts falling out.
Yeah.
This is a big problem in the country. Malnutrition in women during pregnancy, particularly in Sindh. They get married at 14, 15. There's no nutrition count. They give birth to preterm children,
There's no
small
contraception.
children. No contraception. There are 8 children at home. No one is taking care of the 9th. Infection happens to the kid. Majority of the kids die from sepsis. So this is a whole vicious circle.
Right.
That stems from somewhere, which is a very small issue.
Right.
And if you have a doctor in that community, that small issue is going to be solved. I'll tell you another example. In one of our clinics in Karachi, we had an Afghani girl. She was 13, 14 years old. So she just hid minarchy and she was married off. Now, when she came to one of our clinics, she'd had 2 stillbirths already.
At 14?
At 14.
Wow.
So because she got pregnant, she had a stillbirth, she got pregnant again, she had a stillbirth again. The third time she came, The doctor asked the nurse to examine her, and of course, in her way, she asked her, "Okay, what is the physical position of the girl?" Because that girl was so young and petite, her body had not developed for a physical birth at that time. Now, if she had a C-section the first time around, she would not have had stillborn births because there was no space. Because those babies are big and they need space to come out, and her body was not prepared for it. So the third time, all that the doctor did was she sent her for a C-section, saved the child, saved the mother, and no one was telling her.
These are just mindful interventions.
And imagine losing 2 children and going through labor 2 times at 14
At
years
14,
of age,
yes.
and losing the child at the end of it. These are all very real stories. So I think the best thing that our doctors are providing in the community is right information, right counseling, right diagnosis, and right medicines, which can help all the primary care issues in the community.
And the lack of this is why, we say the healthcare system is broken.
Yes.
And that's what my understanding of what Sehat Kahani is trying to do is you're trying to fix the system. And is this the only way that you feel the healthcare system is broken? Are there other reasons?
See, there are a lot of issues in the healthcare system. There are a lot of gaps. There are gaps in supply chain. So we don't have a lot of doctors. We don't have skilled nurses. We don't have skilled workers. We have counterfeit medicines across the country. We don't have authentic medicines.
Right.
In our clinics, since 2 years, we've started making pharmacies as well. I never wanted to
Right.
go in the business of pharmacy. The reason why we had to do it is जब patient हमारे clinic में आता था तो या तो वो ठीक नहीं हो रहा होता था या वो गायब हो जाता था. ठीक इसलिए नहीं हो रहा होता था कि जाली दवाई थी. गायब इसलिए हो रहा था कि जब वो फार्मेसी में जाता था तो फार्मासिस्ट कहता था डॉक्टर को दिखाने की ज़रूरत नहीं, मैं तुम्हें ठीक कर दूंगा, और अपने पास से उसको बंटियों की तरह दवाइयाँ खिला रहा था. So these issues happen when you start unraveling one piece. You just get on with it. But to your question, for me, I Sehat Kahani alone or anyone alone cannot fix the broken healthcare system. But the way I see it, the way my vision goes, the way Sehat Kahani's vision goes, is everyone today is directly landing into tertiary care hospitals.
Right.
So if you and me get sick, where do we go? We go to AKU. We go to South City. That's a tertiary care hospital. We should not be going there unless we're very, very sick. Why does that happen? Because there is no primary care chain in the country. There is no secondary care chain in the country. There's only tertiary care hospitals. Now, we can go to primary care doctors if we want to. Imagine a person living in the rural area that has no doctor in primary care. So they wait until their issue gets so worse that they have to go to a tertiary care hospital. They won't start early. I think one of the reasons why I'm so passionate about primary healthcare is it's a very personal thing to me also, because my father, he got his first heart attack when I was 11 years old.
Right.
That was the first time we realized, or he realized, that he had a heart issue. For 11 years before that, he had high blood pressure. Never took a pill for it. All it required was 1 pill a day because he didn't know. He did not know that if he's not feeling well, it is because of high blood pressure. There was no awareness. There was no education. And he never went to a doctor. The only time he went to a doctor when he was half dead, landed in the emergency and had to be revived again and lost 60% of his heart. In his entire life, for the next 30 years, everything was determined and derived from his health condition. I don't think he lived the quality of life that he could have if he didn't have this issue.
But it's fascinating to me that this is coming from an educated family.
Yes,
So
absolutely.
imagine if we can fall short in taking care of ourselves.
But we don't. Even today, unless we feel very, very sick, we don't go to the hospital. I was in a camp in KP and there was this elderly uncle that came to me, very cute Pathan uncle, and I checked his sugar and it was 450. And I told him कि आपकी sugar बहुत बड़ी भी है. So he got happy. Because I realized then that they actually feel that diabetes is a rich man's disease, because the more meetha you can afford, the more sugar you get. So in their perception, having high sugar is actually a good thing. Now imagine this, that they don't even know what high sugar is and what low sugar is. So how will they take care of themselves? That's why Pakistan is the worst country in the world for diabetes today. It's the number one country, because it is so much in our genetics that it's continuing from generation to generation, and no one is taking care of that in their early 20s and 30s. So my father's had a family history of hypertension. No one knew.
Yeah.
So I believe that even if we can try all our best to fix issues in primary care, I think that is a big, big gap in the health ecosystem today.
And when you got this idea for sort of addressing this problem that was so evident, how does a doctor decide to turn this insight into a potential business? And how do you sort of convince other people to embark on this journey with you? Like, what was going on in your head? What was going on in your heart? Like, what was the storm inside?
Yeah. So when we launched our first clinic in Model Colony, we had actually gotten some startup funding in a competition.
Okay.
So I had around $25,000, and I think my first instinct was that I need to use this money
Yeah.
because someone has trusted me with
Yeah.
it, right? Now, when my second clinic failed, that's when I realized that I can't just run it on a hunch. Like, ye acha lag raha hai, yahan khol do, ye nahi acha lag raha. So I think I took that failure very, very seriously in my life.
Sure.
And then I realized that if I have to run this, if I want to do this right, I need to equip myself with a lot of entrepreneurial knowledge that I didn't have. Because I was trained as a doctor, and doctors are very far away from business or entrepreneurship. We are just told to how to communicate with one patient.
Right.
Clinic kaise chalana hai, ya surgery kaise karni hai. So then I enlisted myself in a lot of entrepreneurial accelerators. And I think the first accelerator that I was a part of, and I'm very lucky that I went to I2I, which is Kulsum's accelerator. And I think Kulsum was the very first person who gave me kind of authentic and completely solid feedback on what I was doing right and what I was doing wrong.
Yeah.
And she actually mentored me for 6 months along with her team, that this is how you need to get customer acquisition, this is financial modeling, this is how you need to write a business plan. So I started from that level.
Right.
But I think I have this thing in me that even when I was doing medicine or during school, if I got stuck somewhere, I needed to know the reason behind it. So I start questioning myself, acha ab ye kaise hoga? Acha ab ye kaise hoga? So the only thing that made me happy for medicine for a long while is I was really bad in maths, numbers. So I was really happy when I went into medicine कि अब maths नहीं पढ़ना पड़ेगा. So when we started financial modeling, that was a completely alien thing from me. I did not even know how to put things in an Excel.
Yeah.
So I remember in I2I, they gave us a virtual CFO. And that guy used to sit with me and Ifat and actually tell us from scratch, ये number यहाँ डालें, इससे ये होता है, इससे ये होता है. I think the good thing in us was we wanted to learn.
Right.
So we put in a lot of efforts getting that information from people. And I think all my life, the reason why we're here today is because we've gotten really good people who've mentored us. And we've taken that feedback very positively.
Right, it's a two-way thing.
Yes. So whenever we used to do a pitch or do some event or launch a business, we would go back and ask them, yaar, isme kaisa tha? Aap hame sahi feedback dein. And we've always taken that authentic and uncensored feedback from people. I think that is one thing that led us here. Plus, it's not just me who's running the company. There's also my co-founder. So we were two women together. And I think that has been the secret ingredient behind our success, that we pulled each other up. So in hard times, if I'm feeling down, she will pull me up.
Right.
And if she's feeling down, I would pull her up. One thing that we knew from the start is we are giving up a lot of things running this company. So we did not continue our medical careers. We had one child when we started this. We had our second children while building Sehat Kahani. Of course, it takes you away from family. It takes you away from a lot of social things you want to do. So we were very clear from day one that if you're doing it, we have to do it to the best of our ability.
You have to go all in.
Yes. We can't do it halfway. And we will try our best to the end point that it is a success and not a failure. Of course, if things don't go your way, that's another thing. But that kept us going. Third, I think wherever we went, so for example, when I was raising the first time in 2018, and the raise was to create an application, everyone that I went to, that I knew in my circle, and I asked them for money, majority of them had one reaction कि आप इतना अच्छा काम कर रही हैं, आप इतनी अच्छी सोशल एंटरप्राइज चला रही हैं, क्लिनिक्स खोलती हैं लो इनकम एरियाज में, आपको क्यों बनानी है ऐप? Why do you want to come to a technology business? Because women running a technology business was still a very alien concept at that time.
Yeah.
I mean, women running an NGO or a social enterprise is okay because it's a soft thing to do.
Yes.
But women making money, running technology, a lot of people thought we couldn't do it. And a lot of people told us on our face that you're going to regret this.
Right.
You should just laser focus on your clinics. I think when we used to come back from those conversations, rather than feeling demotivated or thinking कि शायद हम नहीं कर सकेंगे, we had this natural instinct कि नहीं अब तो हम करेंगे.
हाँ, करके दिखाना है.
Now we will do it, and now we will do it with even more strength. So every time when someone pulled us down with those conversations, we just came back stronger.
It was like pulling back a rubber band.
Yeah, and we did come back stronger. So when we made our application, it didn't sell for 6 months. But and no one was appreciating it. Right now, a lot of people use it, and it's a very easy and convenient option to use. But in 2019, if you tell someone that there's a doctor available on an app, no one would believe it, and no one would buy into it. And nothing happened for 6 months, but we kept selling it everywhere that we could. We kept going. क्या 1 साल तो हमने इसको बेचना है किसी भी तरीके से, चाहे बिके या ना बिके. How God helped us was that after 6 months, COVID happened.
I was waiting to ask that.
Yeah. And because I had pitched at so many places, and Ifat had pitched so many places, someone from the government heard our pitch and called us and said that, okay, we've found out that you have an app that connects you to a doctor in 60 seconds. We need an app that would connect people going in lockdown to doctors in 60 seconds. Give us the app for free, and we'll give it to everyone in the country through the federal government platform. And that changed things for Sehat Kahani overnight. From 2-3 patients a day, we actually went in 3 months to 1,000 patients a day, to a point that people were coming and we didn't have enough doctors and resources on the app to actually cater to them. That's how much traffic we were able to create.
Literal divine intervention to like give you proof of concept.
Yes, and at that time when my friends were gardening or cooking and enjoying the lockdown, me and the team were working 16 hours a day, because we knew that if we cannot prove this model at this time, where going to physical doctors is risky, so online doctors are better, we won't do it again. We won't give this golden opportunity again.
Exactly.
And everyone in my company, the whole 50-60 people that we said that we are going to work till we can get that proof of concept in. And we did. And those 6 months, we increased our tech team, we established our call center, we increased our team, we defined our portfolios into corporate consumer clinics. And that kind of roadmap we still follow today. So I think a lot of it was really learning quickly.
Yeah.
Pivoting if something is not working and trying new things. Not being afraid कि यार fail हो जाएंगे तो क्या होगा. But getting up the next day and thinking of new things. And really equipping ourselves with a lot of networks and connections to make sure that we had the right mentors.
So this is, I don't know how to like make this very clear, but like, you started as a social enterprise.
Yes.
And then the business model changed and it became more financially viable. How do you sort of maintain that balance so that the sort of the spirit of the brand and the spirit of the company is not lost in the sort of the business growth side of it?
So I think when we launched the app and the app started doing well, and it's a natural tendency, if some vertical is doing well, you kind of pull all your resources towards that vertical. So the app started getting popular. We got a lot of corporate contracts to the point that it's the largest corporate app today in Pakistan that is used by 900 corporates. So obviously there's a lot of work that happens behind the scenes. A lot of team is involved in it. So a lot of people ask me this question that don't you think that you did unfair or injustice to your clinics? So my response to that is that from day one, I did not like asking for money. That is my personal thing.
Yeah.
I always wanted to make a business which is sustainable. So even in my clinics, we always charged for the services. They weren't free or pro bono clinics. But of course, the money that we're creating from those clinics were enough to break even at that clinical level.
Got it.
It wasn't enough to grow the company into different verticals, to extend into different verticals. So we needed a high revenue vertical. Today, I'm glad that we have 2 separate teams in the company. One that brings in the money and one that brings in the impact.
Right.
And both of them know that we are here to bring the money and we're here to bring the impact. In fact, when we started raising for our pre-series A round, in 2021, I got a feedback from some of the investors or kind of mentors that do not pitch your clinics. Only pitch your app. Because a commercial investor does not want to see a social cause.
Okay.
Me and Ifat, and that was a very, very, very solid feedback that was given to us, that remove your clinics from the picture completely, only raise for your app. But me and Ifat took that decision that no, our clinics are as important to us as our application, and we will pitch both of them together. And we will pitch this impact business model. If someone is not comfortable with it coming in, that's their decision.
Right.
But we're not going to hide a part of our business just because it's not cool enough to a commercial investor. Or if you're pitching to a grant, we won't show our app. No. We are very clear that the money goes from one vertical to another. Resources are cross-subsidized, and we're very clean in our books as well. So we will pitch it all together as one business. And eventually we found 17, 18 investors who have invested in Sehat Kahani, who bought into this complete idea of being an impact business.
And these are international investors, local
Both.
investors?
So majorly international, but there are some local investors as well. But then we found a lot of impact investors that needed that impact to be a part of the model as well. So no, the focus hasn't gone away from the clinics. I think the focus has become more holistic. And the focus is that what is the end purpose of the company? The end purpose of the company is to stop a patient's disease at primary healthcare. Whether that patient is coming from a rural area or an urban area, that's not what defines our effort. Our effort is whoever is coming through whatever channel, and these are all channels, right? Wherever they're coming from, the quality of the consultation or the service should be uniform. So our rural patient should get the same quality of service as someone who's a bank customer. And that's something that we ensure every day.
I think so. How has your pitch changed from like the first time you went and pitched Sehat Kahani to an investor to like now when you go for another round or something? You know, from the way you sort of walk into a room to how you talk about what you do, and just that, like, do you walk straighter now? Do you like, what is the difference? How do you feel it's changed over the years?
I think when I used to walk in initially, I had to gather that credibility in the room after the pitch. Now when I walk into rooms, I know that I have a certain credibility. The company carries a certain credibility. So that the effort is not to establishing myself as a female founder or leader. The effort is to establish our business as a business.
Right.
Or whatever pitch I am, if I'm there to give an opinion, if I'm there to give a feedback on certain thing at the policy level, I think the focus is more on the topic rather than me and Sehat Kahani.
Right.
The focus is always on the audience. What can I provide as someone who's in the room? So I think before, when I used to walk in the room, my ask was what the people in the room can give me.
Right.
I think now my concept is what can I give back to the people to the room.
Right.
So I think that's how it changed. But I think the energy, the passion about Sehat Kahani and pitching its different verticals, it's there till today to a very crazy level that sometimes, my husband asks me कि तुम बोर नहीं हो जाती? एक ही चीज़ बोले जा रही हो पिछले 7 साल से, इंसान बोर हो जाता है. So I say no, I think every time I pitch about it, there's something new to share. Something new has happened at work.
Also, the problem itself is at a scale where you never actually run out of things to say.
Yes.
It just keeps evolving.
And also we keep building, right?
Yeah.
So we build our clinics, we build our corporate app, we build our consumer app. Now we've built our complete OPD management portfolio for our corporates so they can do all their OPD management work. The newest thing that I'm very excited about building right now is home healthcare. So we actually launched a service for geriatric, old age and special needs patient that we will send nurses to patients' home 24/7. Like, you get attendance to take care of sick people. But the added layer that we are adding is that those nurses are going to come with quality. Whatever data the patient has is going to be on an application that can be reviewed by the patient as well as the attendant who may not be there in physicality, because this is a big issue for the country that a lot of young people are moving out,
right,
leaving sick parents behind.
Right.
And even if they hire an attendant or a nurse to take care of their parents, they never know what's going on.
Because the verification process, the background checks.
And there is no data being recorded anywhere, right? They would just come and take care of the person.
Right.
Maybe do a couple of vitals, but where is the trend? How would you know that 5 days ago, the sick person did not have a high blood pressure event,
right,
or their urine output wasn't normal enough, or they didn't eat well? So to that, you need to gather that data on an app. So when our nurse goes to a patient in a 12-hour shift, they will record their vitals, they will record all the things that they need to record for the patient on an app, and the next day when they go back again, it will create a trend. So over time, you can actually see a trend
And this data is accessible by the family members.
by the family member.
Right.
And if there is an event, so we've actually clocked variables behind it. So for example, if I'm caring for a sick person and they have a high blood pressure event, their blood pressure shoots off, it's going to create a trigger in the app.
Like a panic button. Or
Exactly. And the doctor who's insured of that case will, an online doctor, because in online doctor service, will actually call the patient. That what happened? Are you not feeling well? Change the medicines. Immediately decide if the patient has to go to a hospital now because something has changed.
Right.
So, and this is called this is a very popular concept developing all over the world, which is called out of hospital care.
Right.
Because a lot of people don't want to stay in the hospital or don't have money to stay in the hospital long term. So how can you create a system that can take care of a sick patient out of the hospital in a patient's home using providing good caregivers, monitoring their symptoms digitally,
Right.
and also having an online doctor support network that can help them. So that's something that I'm very passionate about now because I have been through it with my father and I know the gaps in that service area.
100%.
And we're building it with a lot of passion and a lot of care so that we can provide the right care to the patient at the end of the day. So now I'm excited about selling that.
Okay, that's amazing. So my next, I think this sounds like a very technical question. It's a word that gets thrown around in the startup space a lot. You're consistently scaling.
Yes.
You're consistently coming up with these new verticals for Sehat Kahani. How do you sort of scale but avoid excessive burn?
Yeah.
How do you sort of not overexert the budgets, the investment, and not, a lot of startups fall victim to the burn. How do you manage that while still investing in the resources that you need but not going overboard?
So I think we've always built smart. One of the things that really helps us is 3 of our verticals are cash first verticals. So in our corporate application, we get paid on a retainer basis to give services to corporate users. In our OPD management system, we get paid in advance to provide those services. In home healthcare, the patient pays us on the first day to provide those services. So we get cash first.
Got it.
In our clinics, whenever a patient visits, they have to pay. So it's a fee per user.
Right.
So there is no payment that is coming. There is very limited payment, a very limited vertical where payment is subsidized or discounted, which is a consumer app vertical.
Right.
Now, when we raised our pre-series A round, we started expanding rapidly, like all businesses, right?
Right.
We got excited that we have a lot of money. Now we can invest in corporate, we can invest in consumer, we can invest in our clinics, and we hired a lot of team for it. But as soon as we saw what was happening in the country as well as region, we became cautioned. We said, no, we need to conserve our resources. So we didn't pull anyone out of the company. We didn't lay off. But we did 2 things. We reduced our marketing expense and we reduced spending on our consumer application, which is a lot of growth marketing that goes into it, which is in dollars, which creates a lot of burn. So I believe that as founders and as team members, our first instinct is we have to save our team. We don't want to let anyone go because of lack of expenses. So we will cut off all the variable expenses in the company.
Right.
Plus, whenever we start a vertical, it is not just that one day I thought, okay, मेरे फादर के साथ एक बुरा एक्सपीरियंस था होम हेल्थ केयर में, चलो मैं होम हेल्थ केयर बना देती हूँ. नहीं, we have worked on home health care for 12 months. We did a pilot of 6 months. So it has been going on in the background for 18 months.
Right.
From financial feasibility to operational feasibility to business planning to marketing to what kind of services we can provide, what kind of training we need to give. So it is a very thought through process.
Where
And
you've
we've
worked out the
only-
teething issues and everything.
Exactly. So we've only done it because it makes financial feasibility. If a vertical for me today does not create financial feasibility, that means if I put my resources in it, there is no profit margin at the end of the day, I won't do it.
Sure.
And there are a lot of things that people ask us to do, कि ये कर लें, ये कर लें, ये कर लें, but we say no to them because we know at the end of the day that profit margin is very important for us.
No, absolutely.
So every vertical comes with a thought process. There's a team who does research, feasibility, financial feasibility, operational feasibility, tech feasibility, and all of it that comes together in launching a new vertical. So my job is to sell it.
Yeah.
But there's a lot of work that goes behind to actually launch those verticals as well. So we've been very cautious. Everything is based on a unit economic model. Everything is based on a profitability structure. And we only increase costs incrementally as we start increasing the vertical. So I will not hire 50 people for home healthcare on day one. I will start with a small team of 3-4 people. And once it starts making revenue, then I will increase my team incrementally.
And as you build demand.
Absolutely.
Sure. So you said that like you cut back on marketing, but marketing eventually also leads to partnerships. And I mean, mashallah, so you guys have a lot of really great partnerships.
Yes.
How do you find that balance in scaling back on marketing but achieving partnerships? And what are some really amazing partnerships that you've had?
So I think when I say we cut back on marketing, it wasn't cutting back on our main marketing channel, which was marketing to our partners or creating awareness about the company. It was marketing on particularly consumer application, growth marketing, which is getting new users in, getting more retention in. And that was for a while where we were trying to conserve our expenses. But I, for one, believe that, and people kind of taunt us at some times कि आप हमेशा जाके बस बात करती रहती हैं और कॉन्फ्रेंसेज अटेंड करती रहती हैं और अवार्ड्स
काम
लेती
कब
रहती
करती
हैं
हैं?
काम कब करती हैं आपका फोकस काम पे नहीं होता. But I believe that when you come from a background where you don't have a network, you have to build that network yourself.
Absolutely.
Who is going to talk about your work if you're not going to talk about it? So we have to bang that door twice as much as compared to someone who comes with
Sure.
a network to make sure that we are heard. So we didn't cut back on marketing as much. I think in terms of partnerships, we're very blessed to have a lot of good partners and very blessed to keep a good relationship with our partners as well. So when I was growing the company between 2017 to 2018, where we didn't have any funds, we applied to a lot of grants, a lot of soft funding opportunities. And those funds have eventually stayed with us and given us follow-up funding and follow-on funding. But that was only because when you got that first fund, we were able to use them and actually create a good relationship with those funds as well to show them that we are credible people who will use the funds widely and grow our company.
Right.
So it's a two-way relationship. But for example, if I name some of those partnerships, I think with USAID, I think I've had a wonderful relationship. They've really helped me. Again, with Eye to Eye, an extremely good partnership of mentorship, of collaboration. When we launched our corporate application, the concept of a corporate employee getting primary care via an app was extremely alien. The reason why it worked for the first 3-4 companies is because COVID tha, employees were in a lockdown. They had no other service to provide that service to the end corporate employee.
Right.
The first 4-5 companies tried it. They had people on the boards that were sitting on other boards, and they recommended us. And that's literally how the word of mouth grew, that there's a company in Pakistan that would provide primary care to their employee. The first bank that took it, the first major bank that took it was Mizan. When Mizan came with 13,000 employees, I think that really changed the table for us.
Game changer. For sure.
Absolutely. And then insurance companies saw that, okay, this is such a great product. It's really going to help us provide a solution of primary care, which is eventually going to reduce our claims. Because if people get more primary care, eventually a lot of people will not get admitted to tertiary care hospitals. So insurance companies saw a very, very big cost benefit.
Yeah.
And then Jubilee partnered with us, which is one of the biggest
exactly.
insurance companies. And they trusted us with the service. And then a lot of insurance companies came in. I, for one, have had really good partnerships with the government as well. So we were able to create 13 basic health units in Azad Jammu and Kashmir with the government. And in a model, which is the eventual succession model of our clinics, in which instead of the patient paying us, the government pays us. So it's a B2G model.
Oh, great.
So again, a great partnership that's continuing over 4 years. My main cloud partner is Microsoft. Microsoft has actually enrolled us in 3 programs till date to build my team's technical ability, and has been going strong since the last 6 years that we've launched business. So in every space, we've been able to find those trusted partnerships that not only help us at that time, but also keep growing the partnership with us. My investors, I mean, the first person who invested in my company, his name is Danish Elahi. And he came at a time when no one was investing in Sehat Kahani. No one. And he came in and he invested. And he talked about us in 5-6 circles. And that's where I got more of my investors. And then eventually a lot of people invested, but he was the first person who gave us $100,000 to run the company.
Okay, I mean, I know Danish, and I know he's got that mind. And I feel like that comes with someone from the same sort of age bracket, also understanding
I think he understood the value of
Yeah,
the business.
exactly.
The first time that we actually went to take a check, me and Ifat were both expecting our second daughters.
Right.
And for an investor to still invest in two women who are having their second children while raising a round.
Which is basically this space where a lot of women get laid off or people don't want to hire
Yes,
women.
and
or-
people don't trust them.
Yes.
Okay, एक बड़ा सवाल है कि will they even continue?
They're not reliable. Women are not reliable because they'll have
Will they
babies.
come back after
Yeah,
the second
exactly,
child? Will they be able
exactly.
to give their 100% while having two children in the family? But he never said a word. He gave us the check and he said, this is for you to use. And I think that opened the door and gave us the confidence to pitch to so many investors today.
Right.
In our recent round that we did, our Series A round, again, the funding climate was so bad, no one was giving anyone money. Companies were shutting left, right, and center.
Yes.
And we found a group in Singapore, which is called Amana Circle, which is led by Pakistani investors. And because they came from a health background, they understood the value of what we were doing. And amidst so much chaos and so much financial instability, country mein bure halat hain, funding nahi aa rahi, they still invested as the lead investors. So when you do your work, I think you get a lot of people who would end up supporting you. But we've been blessed with extremely, extremely meaningful and long-lasting partnerships.
And I think, and these partnerships end up being, how even in the most sort of micro situations in our everyday lives, the referrals and the networking is what matters. But on like a more macro scale where investment for your company is concerned, the fact that Danish Elahi invested in your company and then talked about you to other people because he's from the business space, I think that is where the value comes in.
Absolutely. And I think all of them have opened doors in different ways.
Right.
So we have a couple more investors who come from the corporate community in Pakistan, who come from the business community in Pakistan. So we have Deen Group, we have Mahmood Ali Shah Bukhari, and we have Danish Elahi. These four have been instrumental in opening the corporate gates for us.
Right.
Then we have 10 Pearls, which is the technology partner who also made our app. The CEO of 10 Pearls is Ishan Aftab. He has been incremental in solving all our tech issues over time.
Right.
Then we have Amana Circle, which is a health-based investor who understand all the health challenges.
Right.
Then we have a couple of investors. We have Epic Angels, which is a female investor group that knows the female challenges of investment and promote us as a female-led company in a group of investors.
Got it.
So each one of them come with very, very specific backgrounds that have helped us grow. And we also did get them on board because of this. So we have talked to a lot of investors. And majority of them, we were not a right fit. And sometimes they were not a right fit also.
Right.
Just because we didn't think that we would get a lot of value out of them. So I think at the end of the day, even as founders, you have to really know what kind of investors you're getting.
Yeah.
And they should know what kind of founders they're getting so that if it's a marriage, it's literally a marriage.
Of course.
Bound by money,
Yes.
which is very risky.
Exactly.
So you need to get that relationship right. Otherwise, you have a lot of disasters.
100%. So let's talk about data. How can you share some interesting insights and stories that can tell us about patient care and how it's improved over the years, specifically using data and how it's sort of impacted how you've grown the business, how you've sort of decided how this business model will evolve, like you're saying, the in-home care and everything?
See, I think I'll talk about a few. I think when we started working in our clinics, when you work in a low-income community, your first instinct is to deal with all the physical health issues.
Yeah.
Right? कि ख़वातीन हैं, gynecological issues हैं, obstetric issues हैं, derma issues हैं. There was some very, very interesting insights that we got from our clinics that helped us to launch the right kind of services. One thing that we noticed was dermatology issues or skin issues are extremely common in our low-income areas because lack of hygiene, sanitation, water quality. And those issues over time turn into very systemic issues that reduce a person's confidence, their ability to communicate. There's so many underwritten challenges that happens when you have dermatological issues. But because skin doctors are considered to be a luxury, they don't have access to any skin doctors in the community because for them, the physical body, heart is important, liver is important, lung is important, uterus is important. Yehi theek ho jaye, bahut badi baat hai.
Yeah.
So that's how I think we put a dermoscope, and dermatology was one of the key areas that we put after a lot of insight. The second thing is, in every clinic, we started doing 2 health education sessions. Now that came in when people used to come in, Literally, women used to ask us, डॉक्टर साहब टीका तो लगाएं.
Yeah.
And we used to tell them कि किस चीज़ का टीका, आपको फ्लू हो रहा है, आप घर पे जाकर रेस्ट करें, यखनी पिएं और ये एंटी एलर्जिक खाएं ज़्यादा से ज़्यादा. नहीं, हमें एंटीबायोटिक दे दें और हमें टीका लगा दें, बिकॉज वो सारे जो अताई हैं या ऑल दोज क्वैक्स आर पुटिंग द टीका टू दैम so that they can get better. So we started 2 health education sessions a month so that people can actually know about basic health issues and how those basic health issues need to be treated.
Right.
Simple things like washing hand or taking care of your menstrual cycle, how to conceive on the right time. A lot of women go through a lot of emotional trauma.
Yeah.
Just because they are not conceiving at the right time in their cycle.
Yeah.
And that's
exactly.
a huge problem in our communities. Family planning, when to space well. Simple issues. The biggest thing that I think gave me the insight was when women used to come into our clinics. They used to come with 5 years of backache, headaches, cluster headaches हो रहे हैं, migraines हो रहे हैं, कंधों में दर्द हो रहा है. Biggest thing is energy नहीं है चलने की, हमसे उठा नहीं जा रहा. So then the biggest insight that we got was that a lot of women go through mental health challenges, particularly in low-income areas, and there is no talk about it, there is no awareness. They don't even know what it is.
Yeah.
And mental health is out of reach for even the rich people in the country.
Yes.
So when you go to rural communities, there's no talk about it.
Yeah.
So then we introduced mental health services in our clinics. So all our clinics now have psychiatrists and psychologists, dermatologists, gynecologists, so specialities according to need, which is all according to the insight. Something that we've seen is that on our corporate application, a lot of people tell us that people don't come to an online app for consultation, right? Or there's no stickiness, that they would go to a physical doctor and not an online doctor.
Because a lot of people become bonded with their doctors.
Yes, or you need to, और वो जो एक बात है ना कि जब तक आप नब्ज नहीं पकड़ते तो इलाज नहीं होता.
Yes.
But we've seen that when you give a value-added service to a patient and they know that it is subsidized, it is cost-effective, it is convenient, if they're at work, their family can use it. We've actually seen that on our corporate app, a person who does 1 consultation actually comes back and does 8 consultations a year. The goal mark is 4 consultations a year.
Okay.
So it shows that there is stickiness. People's behavior is changing. They just need quality. They need consistency. They need convenience. And more people are now heading towards this route where they don't want to go to a hospital or a doctor.
Right.
So these are some very interesting insights that have really paved our work till now.
Right.
One of the other things that we saw was 60% of the prescriptions that we were creating on the app. So when a doctor consults you, they give a prescription.
Right.
60% of them were converting into prescriptions. And we thought that, okay, लोग कहीं तो जा रहे हैं ना दवाई लेने के लिए. Now, are they getting good medicines or not? We don't know. But then we started an online pharmacy. So now when a doctor gives you a prescription, you can actually book that medicine through our pharmacy and order it. So we've actually closed the chain from consultation to prescription to medicine so that we know at what point does the patient fall off and how much are we impacting their primary health care. So these are all insights that have come while building the business.
Yeah. That's amazing. And like in theory, it sounds really seamless and easy, but coming from like a health tech background also, because I've worked in one, I know that just the concept of getting into the pharmacy space is so much compliance and so much like you have to have this research, they have to have this certification, they have to have this license. It's insane. So
but again, I think the nature, I think my nature and the company's nature is when you have a problem, how do you start solving it in bits and pieces? Step 1, step 2, step 3. And eventually I realized that there is a lot of scope of impact in pharmacy as well. Getting that good medicine at the right time to the patient changes so much in their health journey, which is very, very important.
Because we're so used to just over-the-counter popping Panadols wala lifestyle.
Exactly. Yeah.
Yeah. So again, integrating technology with healthcare to ensure seamless delivery is it's a complex task, especially with like data security, and then especially in the sort of the target audience that you're dealing with. How do you manage that? How did you manage that?
Yeah, I think it's before anything else. So one thing that goes really in our advantage is we're 2 doctors building technology,
right,
and not otherwise.
Right.
So we knew that medical compliance or medical malpractice is a very important issue to handle. So at the beginning of our journey, we said if we're not going to do good, then we're not going to do harm as well. So we'll do limited, but we'll do well. That's why we only handle primary care.
Right.
which is something that we can do on the app. So there are a lot of systems that we've put into place that make sure that, the data is encrypted, it is not being shared with any third party. We take consent at the beginning of the consultation so that they know that the data is being stored. We never partner with any third party of using it for research or any publication
Right.
or selling the data to anyone.
Which is so popular these days.
Yes, but we don't do it because we are very particular that we have health data of patients, and then we've put all the security firewalls in place. We are one of the few companies in Pakistan that do security audits regularly.
Right.
Do make sure that if there's any kink in the process, we can straighten it. So these are all technological as well as process-oriented steps that we've taken to make sure that the data is secure, is just within the reach of the patient, as well as some designated people in our company. And that's why we haven't, alhamdulillah, had any data breaches or anywhere where the patient's data was compromised and sent to someone. We're very, very particular about it. And that comes with a lot of doctor training, staff training, technological firewalls that's put over time. And none of it we've done ourselves. So we've gotten a medical advisory board that advises us. We have a security tech firm that does security audits for us. So we've given it in the hands of specialists.
Right.
But we have given them the authority to work for us and learn from them over time as well.
Right.
Yeah.
No, I think, and I feel like, I mean, you don't have to answer this as like a question or whatever, but I feel like a lot of this mindfulness in terms of like data security, because medical cases hai aur ye history hai, it also comes from like the ethics aspect of being a doctor.
Yes.
Also,
yes,
that
absolutely.
mindfulness.
Because even before I was working, even before Sehat Kahani, when I was doing my medicine, ये बहुत बड़ी चीज़ है कि patient का data compromise नहीं होना चाहिए. Even when we share reports, कहीं पर भी, so we mask. और ये सेहत कहानी से पहले की बात है कि फॉर एग्जांपल अगर किसी ने मुझे एक रिपोर्ट भेजी और मैं किसी रेडियोलॉजिस्ट को भेज रही हूँ फॉर एन ओपिनियन, आई वुड एक्चुअली मास्क पेशेंट डिटेल्स ऑन इट. नो वन टॉट मी टू डू इट, बट इट इज माय ट्रेनिंग ऑफ 5 years.
Exactly.
That patient secrecy and security is supreme above anything else.
Yeah.
So I think that has helped us in
Which
this
I feel
aspect
like
of the business
it's a
as well.
consideration that would not be like the top priority for a lot of businesses, but like I think it comes with the territory of being a doctor.
Medical doctor
The
aspect.
medical doctor.
Yes.
So, given Sehat Kahani's focus on providing healthcare to rural and underserved communities, what key metrics do you use to measure the social impact of your service?
So I think there are some KPIs that we have created. So it is number of consultations, number of repeat patients. I think the biggest KPI that we measure in our rural areas is how many patients are we saving from going to a tertiary care hospital.
Yes.
Treating them within their communities, and is their life outcome being improved? So if their issue is solved in 3 visits or less, that means that they're not going to a tertiary care hospital and we've solved their medical issue.
Right.
So I think that's one of the main KPIs or key metrics that we follow. Again, is the medicine effective? So every patient on the Sehat Kahani app gets a feedback call. Every, out of the total patients we get in our clinic, 30% get a feedback call. So we measure our performance and quality based on the data we're getting from the consultations, which is done through a medical audit.
Right.
As well as we get a lot of feedback from the patients to improve our services. And then I think majorly it's around how many consultations, follow-up visits, lives improved at the end of the day in different specialities, and the cost-benefit analysis as well. So how much cost are we saving for the customer?
Right.
That's also something which is taken into consideration.
Okay. So I had another question, but I feel like we're on such a high note right now, but I'm still going to ask the question. You've, mashallah say, I mean, whether you agree to it or not, you've made it. You've done this, you've built this amazing business that has such impact. But is there something you wish you'd done different?
No. I think looking back, I have no regrets. I think at that time, at that moment, whatever happened for a reason. I'm very kind of spiritual around that. So, nothing. I think I would have... The only thing I feel is a lot of people who left Sehat Kahani, I would have... And they left because of their personal reasons. Someone was getting married or doing a master's. I would have done more to make them stay. Because I think at the end of the journey, the people are most important to run any business. And I think those people were really valuable. So I would just do a lot more harder to stop them and make them a part of Sehat Kahani at my own personal selfish level. But at that time, letting them go was the right thing. Because I really feel that those people brought so much value in Sehat Kahani and made Sehat Kahani what it was. But other than that, work-wise, no regrets.
I love that. And coming from like a tech company, I think it's just the perfect sort of closing note on this. Thank you so much, Dr.
No,
Sarah,
thank you. This was
for
so much
being on
fun.
She Talks Business. I'm so glad we actually got to sit down and I actually got to sort of pick your brain on something, on a business that I feel like has, at least I've known about it forever. And especially in health tech, and I read about you in so many places. Because I'm in marketing, I work with companies who end up partnering with you. So your name pops up so often. And because we sort of know each other, this was really inspiring, and to hear your journey and the business side of it. I don't think people have visibility for just what the technicalities of building a business are. Thank you so much for joining us, and we'll see you again next week with another episode of She Talks Business.
If you found this episode interesting, don't forget to like, share, and subscribe.